weight and nutrition in national capital surveys. Most welcome. We'll be sharing our country experiences, perspectives, as well as mapping ways forward on how to make this even more popular, more useful, and more impactful beyond where we have reached thus far. So, working. Oops. It's not there. One more. Okay. Just go. So I would just like to introduce myself. I will be facilitating the meeting today and tomorrow. My name is Maria Nasuna. It's okay. Just maintain it at Maria. It's much easier. Yeah. I work for many organizations, but primarily from the academia, from Makerere University, based in Kampala, Uganda. And outside the academia, I am a process facilitator, I'm a trainer, I'm a coach, I'm a mentor. So it is in that perspective that I'll be taking charge of facilitating this meeting. And I'm very, very confident we're going to have a very productive meeting. Yeah, I'll be working with my colleague who is not yet here, Nicoletta Bono. She'll be arriving in a little bit later. Before we begin off the meeting, I just want to assure us of some things we believe will help us have a very productive meeting, a very good engagement over these 2 days. So it's to share the core values that I believe are going to be very helpful in having a productive meeting. Please relax, right? We have many titles. Right? All of them you can imagine. I'll not even give examples. Just feel relaxed, because then we want to allow the brain to engage very productively in discussing the issues that we discuss. A relaxed atmosphere, of course, seriously working. We want to have a very open dialogue, inclusiveness, appreciating others' contribution. This means also for those who are very beautifully gifted in talking, allowing airtime for others who are not so gifted, and allowing everybody to contribute, and appreciating their different perspectives. This is a meeting we are going to share experience over an innovation. So whatever we come up with, it's ours. It's all of us. We are part of it. You have been carefully handpicked and invited to this meeting because you are very valuable contributor. So whatever comes through is going to be very much our own, all of us. And it requires thinking. It's an innovation that has been tested, that has been worked. Some things work, some things don't work, some things work here and they don't. We want to be able to think, if we're going to scale it out, how can we do things in a way that makes it very useful to each and everybody, thinking beyond the box, and also to be very frank and dealing with real practical issues in a very realistic way, not in a theoretical way. So I'm hoping that these are core values and others you can handle that can be very helpful in making this meeting very productive. Why are we here? And others will emphasize it even more. The major 3 things over the next 2 days, we want to have the women's empowerment and nutrition tool presented. Maybe some of you have worked with it, others have heard about it, others would like to know more. It's going to be presented with the perspective that lessons learned and how to apply it will be given from countries that have working with it. We're calling them partner countries, and to explore ways together, thinking beyond the box, of scaling the tools, the women's empowerment, the WEN, the women empowerment and nutritional tool is a combination of some tools. The experts are going to explain, okay? I'm only a facilitator to make things, ideas come, but it's a combination. I want to explore ways of scaling those tools in support of additional countries who are interested in integrating these tools as well. So the day's agenda is looking like that, so I shared with you. But in a nutshell, I was very careful not to give the numbers because people can get very, very worried. Number 1 up to 20, but there are few. We'll soon have the opening remarks, and then the tools will be introduced to us for a global common understanding. And then we'll have experiences from the countries, the partner countries that have been working with these tools. What worked, what was challenging. And then we shall have them having a cross-country dialogue through a panel presentation. And then we'll also have open discussion. And then after that, we'll go in for lunch. Then we want to see, because these tools, they are not for anything. They are used to collect data that will inform knowledge-based policy making and decision making in the countries. So we'll look at what are those priority policies and knowledge gaps where these tools can be very useful. And then we'll begin to start moving from pilots to adoption. What does it really mean? Through a panel discussion. And then afternoon, you'll see some path forward proposals for a path forward, and an insight to open our minds. What can we think about when we want to scale out these tools? Before I proceed, I invite the opening remarks so that the people who are giving the opening remarks can have a clue of who is here and who is not. I've already introduced myself. We have colleagues from IFPRI. If you could just raise your hand, please. IFPRI. Thank you. You're most welcome. We have colleagues from FAO. Thank you so much. Then national statistics officers from the different countries, those you're most welcome. And we have all of the others we call them the strategic partners who are working with this. Please put up your hand. Strategic partners. I am a strategic partner. And okay, thank you so much. You're most welcome to the meeting. So that's what we have. And in the evening, we have a reception at around 6. Immediately we finish here, we'll be transitioning into a reception. The venue will be announced later. So without much ado, I'm going to invite the opening remarks. Thank you. So we're going to have opening remarks. I'd like to invite Dr. Nicolene Lehan. She is the Director, CGR, Gender Equality and Social Inclusion Accelerator. Dr. Nicolene, you're most welcome to give us the opening remarks. Thank you.
Thank you. Thanks as well for inviting me. It's an honor to be here, and partly because when I started working more and more on gender in my past, one of the things that I was always quite curious about is how do you move from intra-household relationships, which we were doing a lot of work on, to actually doing it more at a national, global type of level. And so this is one of those examples where it actually works. And so that's why it was also wonderful to see how many people from the statistics departments are here, because that's what's important for us as well. As I always say, if we can't make the invisible visible, we wouldn't be here. And for gender, making the invisible visible is incredibly important. So anyway, for this meeting itself, I have 5 actual key messages I want to leave you with, so you remember it as we go through. So the first one is the whole issue of empowerment and nutrition are foundational for food systems transformation. We all understand that. If we don't understand women's empowerment and dietary diversity, they are not actually just side issues, but they are central to achieving resilient, inclusive, and sustainable food systems. So that's one, the combination of those two, which I think is very important, and that's what we're going to be discussing here. The other one is from measurement to action. How do we actually use these metrics? So these metrics provides governments with actionable data to design policies that close gender gaps in agriculture, improve productivity, and enhance well-being. Again, one of those moments where I think it's important. So that's number 2. And then number 3, which is why you guys are all also in here in this room, is scaling is about partnership and political will. What we're trying to do also in this 2 days workshop is actually figure out how can we scale some of this work. So being here with all of you will help us figure that out. So initial scale up in Liberia, Sierra Leone, and Tanzania show what's actually possible. Now adoption depends on collaboration between national statistical offices, ministries, donors, and technical partners. Again, why we're all in this room, to make sure that that happens. Then number 4, I still have 2 more, this 4, data drives investment and accountability. Again, one of the things we're realizing more and more in this world is there's an increase in accountability to all of us. With less and less money going into places, it becomes more and more important. So having good data is, of course, very important. So empowerment metrics like Women's Tool help countries demonstrate progress towards SDGs and attract resources for gender transformative programs so that we move beyond just counting the women, but actually moving to gender transformative approaches, which we all find important as well. Number 5, the so what question, linking evidence to policy impact. Our challenge is not just to collecting data, it is ensuring that these insights inform real decisions on land right, nutrition, and agency at scale. Again, let's not just keep it at the data, let's also have action. So as we say, data is power, but only if we use it to change lives, and lives in the right way as well, because data often gets used in the wrong way too. Let's turn women's from numbers into action and make women's empowerment the engine of food systems transformation. So our call to action, and I'm quoting directly from Hazel here, is I invite all of you, governments, donors, researchers, and advocates to champion this matrix, integrate into your strategies, and ensure that every policy decision reflects the voice and realities of women. So when we leave this room, let's remember that. And like I say, I think it's an amazing moment that we're all in this room to move the gender agenda into a bigger scale, into a way that we can actually transform lives. So thanks again for coming. I hope you have 2 wonderful days. I hope to catch up with everybody. And I hand over to Maria.
Thank you so much, Nicolene, for those very stimulating call to action to move. If we have data, it's useless until it has been transformed to informing decisions that impact lives positively. Thank you so much for that wonderful the introduction is one that is really going to inspire us to hear about these wonderful tools that are hopefully going to be used as data with, data is, a story. It begins the story on how we're going to move to impact lives. So right now, I'm going to invite the speakers to come and introduce to us the I have Dr. Agnes Sifudi, who is the Senior Research Fellow, the International Food Policy Research Institute, going to share with us the tool to begin with. And then I'll have also Dr. Kwame Osei. Is Dr. Kwame Osei here? Yeah, he will also be sharing with us one of the tools, and then Dr. Stefania Isipe, a statistician with FAO. Yeah, so they're going to be sharing with us these wonderful tools for obtaining data. What you address.
Thank you very much for the introduction, Maria, and thank you everybody for making time in your schedules to attend this workshop. Those who you are here in person and also those who are joining us virtually. So I'm delighted to present the Women's Empowerment Metric for National Statistical Systems, or WOMENS, on behalf of the very large team that developed it. And this includes, This includes colleagues from IFPRI, the World Bank Living Standards Measurement Study, Emory University, Oxford University, and our country partners, Data from Bangladesh, which is represented here by Zihad, Voz Latina from Guatemala, the Malawi National Statistical Office, also represented here, and interdisciplinary analysts in Nepal. I'm also very excited, and this is a bit of a preview, that we have the results from 3 countries through FAO and the 50 by 2030 initiative. I'm not going to make my speech very long and detailed because I'm sure everybody is very excited to see what has come out from the field. So this presentation is going to be a broad overview with a lot of the more technical details to follow tomorrow. So the first question is, why were we interested in measuring empowerment? We realized the value of measuring empowerment when we reviewed a portfolio of projects with women's empowerment objectives. This was the Gender, Agriculture, and Assets Project Phase 2, which brought together 13 agricultural development projects, and we reviewed their project strategies. And we found out that even though they were all supposed to be women's empowerment projects, their strategies actually fell into 3 categories. Those projects that reached women, so they visited them, they held activities that were convenient to them, they tried to increase participation of women, that's in the left corner. Those that benefited women, so they led to tangible improvements in their welfare, for example, by increasing their income or by improving their nutritional status. And then there were those that really aimed to explicitly to empower women by helping them make strategic life decisions and to put them into action, encouraging their input into decisions. So empowerment really means more than just showing up. It means more than benefiting. It really means having an input into choice, making choices and being able to act on them. So we found out in this portfolio project that there are many indicators of reach and benefit, but rather few measures that really measured empowerment. So it is very difficult to find out whether the projects really empowered women, because when we started this work, there were very few adequate measures of empowerment. And even more difficult, these measures weren't standardized, so you couldn't compare empowerment impacts across a project portfolio. And this is important for donors, because for donors to know which of their projects are doing better at empowering women and which one are doing less well, you have to have a common metric. So of course, since there wasn't any, we developed one. Now that's a different story. So that was ProWea, and that was developed by a team led by Hazel Malapitos here. How do we take this now to the national level? How do we bring it up to the level of policy? So why do we measure? Why is it important for policy makers to measure empowerment? Tony Atkinson, who was behind a lot of poverty measurement, said that metrics matter if they motivate, if they monitor, and if they can influence policy. And so if we want to have a policy agenda that prioritizes empowerment, we have to be able to measure it. So the elevation of women's empowerment and gender equality to a sustainable development goal recognizes that there's an intrinsic value in measuring empowerment because it is an important outcome and not just a means to achieving other outcomes. So since again, this metric did not exist, we invented it, we developed it. So what is women's? So since the adoption of the SDGs, there's been a lot of growth in empowerment metrics. But as many of you know, those of you especially who tried to implement or the earlier versions of the metrics we developed, found that they were very long to administer, were more suited to a project context, and were not necessarily designed to look at the many livelihoods that rural women and men are engaged in. And so this was inspiration for women's. So first, it is survey-based and a direct measure of empowerment. It's not a proxy measure. It had to be short. It had to be shorter than 15 minutes if it was even going to be considered by National Statistical Office or to be used in multi-topic household surveys. I remember before when we were talking about our earlier empowerment measures and people asked how long did they take, and they would and potential users say, oh, it's just way too long for us. That's not the case with women's. 15 minutes. It's aligned with the SDGs, so women's empowerment and gender equality, SDG 5, and other relevant SDG targets. And for those who are interested in how the recipe, what the recipe was used, it is counting based, it's decomposable, and you can compare subpopulations. It has the same DNA as the multidimensional poverty indices. So it's an index with component indicators using this methodology. So the process of developing women's was consultative. We used a consultative iterative process to develop women. And using stakeholder consultations, cognitive interviews, phone surveys, and face-to-face surveys. After it was launched in February 2024, it has been integrated in national agricultural surveys in Liberia, Sierra Leone, and Tanzania, thanks to the 50 by 2030 initiative and FAO. And we will hear those results today. So we're very excited for the next presentations, which will talk about this. So what is women's made of? So for conceptual justification, it's grounded in theories of empowerment such as those of Naila Kabir, Joe Rollins, and Paulo Freire. And if you look at women's, it's like a pie in 4 sections. One section is intrinsic agency, or the power within, which is a critical consciousness and awareness of inequalities, the ability to make choices to change one's life. It comes from inside you. Instrumental agency, the second slice of the pie, is the power to, or what we associate with economic empowerment and decision-making. Now, decision-making is only one aspect of agency, although it's a most commonly used measure. The third slice of the pie is collective agency, or power with, focuses on the empowerment that can be achieved when individuals come together. It's beyond the household. Finally, the last section of the pie is agency enabling resources, the material, human, and social resources that enhance the ability to exercise choice. To concretize, we have the women domains and indicators. So imagine that each section of the 4-section pie is divided into 3 slices. So the questions assess the questions which of the individual slices assess the following. So for intrinsic agency, they measure endorsement of women's freedom in livelihood choices. Note that these livelihood choices are not limited to agriculture because we wanted a measure that could be fielded in national surveys, not just agriculture surveys. Endorsement of women's freedom in family formation choices, and rejection of women's subjection to sexual harassment. Now, these indicators, the ones with asterisks in the intrinsic agency domain, are only collected for women. We found while pre-testing this that these concepts were not salient to men's experience and did not really function well as indicators for men's empowerment. For instrumental agency, the indicators capture influence over time allocation, spending decisions, and own health decisions. So for those of you who are used to the previous time use module in the Women's Empowerment Agriculture Index, this is different because it's about your agency or your influence over time allocation, how you use your time, and not actually measuring how much time you spend in each activity. So it's much shorter to administer. For collective agency, include participation in organizations, leadership in organizations, and support for women's and men's community engagement. And finally, for agency enabling resources that help women and men exercise agency, the indicators are the use of information and communication technologies, the use of financial services and access to credit, and secure property rights. You can already tell that policies are going to be very important in making these agency enabling resources available and accessible. So you can use this visual to think ahead or to think about what the structure of women's looks like. So 4 sections and 3 slices within each section. So how does women's then measure empowerment? Recall that for women, we have the 4 complete sections of the pie: intrinsic agency, instrumental agency, collective agency, and agency enabling resources. So mapping that, we have 12 indicators for women. For men, we don't have the intrinsic agency section of the pie. So you only have instrumental agency, collective agency, and agency enabling resources. And so you have 12 indicators for women and 9 indicators used for men. So each domain is equally weighted, and so are the indicators within each domain. So it's 12 within 4 and 9 within 3. So we use a methodology which employs dual cutoffs. It's really the Alkire and Foster methodology, where in the first step, we identify individuals as constrained or unconstrained with respect to each indicator based on an indicator-specific cutoff. And then we identify respondents as empowered if they are unconstrained in at least 70% of the weighted indicators. So, okay, let's take a quick look at the Malawi pilot, for example. In the Malawi pilot survey, we found that 81% of women were disempowered, and that disempowered women were constrained on average in 53% of the weighted indicators. The women's score for women was 0.57. We found out that 62% of men were disempowered, and disempowered men were constrained on average in 48% of the weighted indicators. The women's score is 0.70. So women are substantially less empowered than men in the pilot sample. Now note that this was not nationally representative, and so we really look forward to seeing the results that are coming out in the next few presentations. One of the things I mentioned earlier was that the women's is decomposable. And the nice thing about its being decomposable is that you can look at the contribution of each of the indicators to overall disempowerment. So these bars, these hanging bars, as we call them, for those who are familiar with earlier variations of women's empowerment in agriculture index, show you the extent of this empowerment. And the size of each section of the bar tells you how much is the contribution of that indicator to this empowerment. The longer the bar, the more disempowered. So the figure shows the depth of disempowerment as well as how much each indicator contributes. The key finding that we see here across these countries is that the following areas contribute most to women's disempowerment: the lack of confidence in women's community engagement, which shows up as dark purple, the lack of leadership in organizations, the middle shade of purple, the lack of influence in spending decisions, the middle shade of orange. So we're going to have more discussions about women's and the nutrition indicator, MBBS, following next, and more technical discussions in the next few today and tomorrow. So thank you very much, and I look forward to hearing from everyone in the rest of the presentations. Resources are available here.
Thank you so much for making that. Making the tool look so simple and easy to present. Yeah, so right now we have the presentation. Yes. Advance. Dr. Kwame Essay is the Senior Nutrition and Food Systems Officer at FAO. So over to you, please.
Thank you, and good morning to you all, and morning to those online as well. I've met some of the people in the audience, met almost all of you also through virtual presentation. So today, I'll be presenting to you the minimum dietary diversity indicator, which was adopted or endorsed as an SDG indicator this year in March 2025. So I'll talk, just like the previous presenter, much more conceptually about what the indicator is about today, and go a little more in detail on how it's computed in another presentation tomorrow. So
You might have presented as presented. No, I think it's coming. It's coming, yeah.
Okay. So this indicator is actually based on the work of many researchers and agencies, beginning from about early 2000 all the way up to the head of the Fanta 1, Fanta 2 projects of USAID. All those contributed evidence into this indicator, and a lot of work also by FAO colleagues even before I joined contributed to this. So I'm presenting the work of many stakeholders that FAO is a custodian now of that indicator. So what is the minimum dietary diversity? It is a whole population level indicator for assessing the diversity of diets of women and children. At least under the SDG, two population groups were identified. Women of reproductive age, which is women aged 15 to 49 years, and that age group is very important. And then children 6 to 23 months. So there are two indicators in one under the SDG, and it's under the SDG indicator 2.2.4. So in the framework, we have 2.2.4A, which focuses on children 6 to 23 months. Then we have 2.2.4B, which focuses on women of reproductive age. And the first subcomponent, that of children, is under the custodianship of UNICEF. So I'll talk briefly about it, but not in detail. And FAO manages the second component, which is the 2.4.4B, which focuses on women of reproductive age. So it's a simple population level indicator for assessing the diversity of women and children. And why do I say simple? For those with knowledge in nutrition, dietary assessment can be very complicated, especially when you are collecting dietary data at the field using some of the standard methods that we knew already, like 24-hour recall. Sometimes you need to even go with a lot of measuring tools to be able to capture the quantities of diets consumed. But this indicator does not capture quantities. It's just based on food groups consumed over the past 24 hours. And that's the reference period. And again, let me also say that there are other recalls in terms of, say, household dietary diversity score That is based on household, not based on individual, and the record period can even be more than 24 hours. For this indicator, the reference period or the record period is the past 24 hours, and it captures the diets of women or children in the household, not the entire household. And it focuses also on diversity of the diet consumed. So first, let me explain why are we doing this. We are doing this because we want to, in general, we want to capture what people are eating and what kind of diet do we want to capture. We want to capture the quality or the healthfulness of people's diets. So what is a healthy diet in the first place? There are about 4 global principles that underscores a healthy diet. And I mean here global principles. The principles can be global, but when you get to the context, those principles will underlie it, but the types of food on the plate may vary from one context to the other. But the principles are general and it covers every context. A diet is healthy based on the FAO, WHO guidance or statement that came out a couple of years ago. A diet is healthy when it is adequate. What we mean by adequacy is that it should be able to meet the nutrient needs of the person consuming the diet without providing excess. It is adequate when the diet is balanced. Balance in terms of the macronutrients, the protein, carbohydrate, and the fats, in terms of their percentage contribution to daily energy intake, needs to be balanced. So that's the second principle. The third is that it needs to be diverse. Diverse in the sense that it should contain variety of foods and food groups. And we know that the more varied the food groups or the foods are, the more likely one can meet the nutrient needs. So that's also linked to the adequacy component. And then the last is moderation. Moderation in the sense that we know certain food groups, when you consume more or excess, it leads to negative health consequences. So the diet should give you moderate amount of intake of those, like salt, sugar, free sugar, and others. And I must say that these are the principles underscored, but safety is also very important for us at FAO. If the food is not safe, then it's not even, in my view, a food. It needs to be safe without giving you sickness. So I'll go a little in detail on what constitutes the minimum dietary diversity. First, for women, it measures the proportion of women in a population and the women aged 15 to 49 years who consumed 5 or more out of 10 predefined food groups. And those food groups are defined globally. We have 10 of them for women and 8 of them for children. I'll go into the children's own. For women, here are the food groups. We have the grains, or what we call the starchy source of food, the grains, white roots and tubers and plantains. We have the pulses, which is the beans, peas, and lentils, nuts and seeds, milk and milk products, poultry, meat, poultry, and fish. We have eggs, dark green leafy vegetables, other vitamin A rich fruits and vegetables, other vegetables, and other fruits. And tomorrow I'll use some of the questionnaires that you used in the WEN survey to explain how to group these under the food groups. So if a woman consumes 5 or more of these food groups, that individual woman is said to have met the minimum diet diversity. But again, let me emphasize here, we don't interpret the indicator at individual level. The indicator is validated to be interpreted at population level. So an individual woman in your sample meeting the MDDW doesn't mean all her dietary needs. There is the likelihood that she may meet her dietary needs, but it doesn't mean all her dietary needs are met. But the indicator is validated at the population level. When the population, the proportion of women meeting this means the population is more likely to meet their micronutrient adequacy or micronutrient intake. So again, it's interpreted at population level because we have what we call the inter and intra-individual variation in terms of food intake. This indicator does not capture usual intake. Remember, it's only 24 hours, and as individuals, our intake will even vary from day to day. as we know. Weekend intake is different from probably what you do when you are even busy going to work. So it doesn't capture usual intake. For the children, it's 8 food groups instead of 10. And the difference again between this and the women's indicator, apart from the number of food groups, for children, breast milk is also important. So that's a food group in the children's food group. And as you can see within the milk, dairy products, there is also infant formula there, because those are also important for children in terms of their food intake. I'm not saying before 6 months. We are talking about complementary feeding, which is after 6 months. It has nothing to do with below 6 months. So exclusive breastfeeding is very important during the first 6 months. And here too, if a child consumes 5 out of 8 food groups, then the child has met the minimum dietary diversity. But again, this is also explained in terms of interpretation for decisions at population and not individual level. So what can we get out of this when we administer the questionnaire? And usually, before I move on to that, I must say that the questionnaire that is taken to the field might have more food groups than the 10, depending on the country context and interest of the person doing the questions. Some countries may decide to add, even if you look at some of the global standardized questionnaire done by the Global Diet Quality Project, it has about 29 questions on there. Not all of them will be used for the MDDW indicator, but all of them are relevant for certain decisions. Like if I want to know about intake of sugar sweetened beverages in my country, a food group can be added for me to be able to do that. So the questionnaire can be longer than the 10 food groups required for this. And what is more important is that the questionnaires needs to be adapted very well to the country context. And I'll go a little further into that tomorrow. So what we can get out of this will be the binary indicator in terms of whether a child or woman met the minimum diet diversity, and for that matter, if the population, we can get the prevalence of minimum diet diversity within the population. For women, if it was a women's questionnaire, and then for children, we can get that. Another thing will be proportion of women or children who are consuming each of the individual food groups. We have 10 food groups on there. You can do your analysis to also capture that. What is the percentage of women consuming the meat, poultry, and fish category, for instance? You can do that also with your analysis. And the third is the food group diversity score. I'll show that tomorrow, before you come to the binary indicator of meeting the 5 or more food groups, you need to compute for each woman the 10 food groups. So you get a range within your population of 0 to 10. And that is also a score that you can use depending on interest. So those are the 3 main indicators that can be computed from the questionnaire. And I must say that the threshold of 5 or more food groups at the moment is validated for women 15 to 49 years and children 6 to 23 months. I've seen surveys where they compute it beyond that age group, but at the moment is validated for those 2 age groups, and it mainly targets diversity and the likelihood of that population meeting their micronutrient intake. So if you compute it for other age groups, the interpretation becomes a little tricky, depending on the validation studies that are there. But the other 2 indicators in terms of each food group, in terms of the prevalence, I can do it for any age group within my population. I can compute men who consume meat, fish, and poultry products in my population. If that's of interest to me, I can find out. The same thing with the diversity score can also be computed for any age group. So what are the key attributes of the minimum diet diversity? And here I focused on women because I'm coming from FAO. It's the one under custodianship, but it applies to both. It's simple, as I mentioned, and easy to measure compared to the traditional measures that we know of for assessing diet. The second is that it's less time consuming because you are not capturing quantities consumed. You are just asking a yes or no answer. And sometimes I will show the two questionnaires. Sometimes there is an open record where you capture the foods, but still, at the end of the day, you are not taking quantities. You are just asking, was this consumed or not? It's less costly and then requires relatively minimal skills compared to the others. And here in comparison to the others, because for me to do 24-hour record, I need to train my enumerators very well on how to capture portion sizes. Here, I don't need that. So even the level of training of enumerators is relatively less than the other measures that we know. And therefore, it's feasible to collect frequently and therefore at scale. And that's why it makes it more also attractive for the SDG monitoring, which is required to be done at least every year by countries. Here are the two types of questionnaires that can be used based on our FAO guidance manual. We have the open record, where you don't go with list of foods. You just ask from the time the woman woke up since yesterday till now, what has been consumed. So you can go with a grade, you list the food that is said to have been consumed, and then either at the field or after, you reclassify them into the food groups. And here, because the enumerator will be doing the reclassification, it requires the enumerator to be trained very well on how to capture the foods into the food groups. And that can be quite challenging from context to context, because sometimes even we as a nutritionist, classifying food items into food groups at times can be a little difficult depending on your knowledge of the context. So that's one disadvantage of this. There are others in terms of the cognitive burden and all that, but I won't go into that. We have the list-based, which already predefined list is done. The questions are there. Like the one you used in the WEN survey is the list-based, where the questions are there with the list of foods under each question, and those has already been classified under the question into the food group. The only difference here is that maybe you didn't see that obviously in the questionnaire, because some questions are split across several lines on the questionnaire, some food groups, and in the end, you need to consolidate them, mainly to make it easier to administer the questions at the field. But still, it's very easy because, as I'll show tomorrow, if you know the food groups and you know the questions, you just bring them together and then you form your food group straight away from the questionnaire. So the list-based, the survey team already defines the food groups. They define the questions that are going under each food groups, and all what the enumerator is doing is reading the questions and asking if it was consumed, and then taking yes, no, and then in the end you compile it and then bring it onto the food groups. So it's relatively easier compared to the other measures. So that brings me almost to the end of my slides. We have several manuals on this. As FAO, we have the updated guidance manual, which explains the concepts of the indicator, how it is collected in terms of tools, field preparations before you go to the field and all that. And then we also have an e-learning course, which is online, which anybody can take to mainly gain more knowledge about the indicator and how it is computed. And I'll just talk briefly about what we are planning now as an organization. This year, we did a lot in terms of trying to compile all the prevalence estimates on the MDDW from the different surveys across different countries. The DHS collects it. The mixed survey has that of children, but sometimes they have that of women also included. We have the Gallup World Poll, which collects also for women. And then we have several other national nutrition surveys, which have also integrated it. So what we did was to pull all this data together for the different countries and then validate it with countries for them to accept as their indicator and facilitate its reporting to the UN Statistical Commission. on behalf with the countries or on behalf of the countries as part of the global SDG 2 monitoring. Moving forward, we plan on working with countries in terms of enhancing knowledge and capacity on how to collect and compute the indicator. We are planning several regional workshops across various FAO regions, which is global. And then we also plan working mainly the workshops and others focusing on national statistics offices who are the main data generators, but then also working with data users, managers and others from different ministries who use the information to enhance awareness and knowledge of the indicator, and then facilitate the dissemination on our platforms, our flagship reports, as well as reporting to the UN statistical division. And within the WEN survey, we supported in terms of the questionnaire formulation, in terms of the design of the questionnaire, the food groupings, and then also we supported with the analysis of that. So lastly, we have what we call the Healthy Diet Monitoring Initiative, which is interagency initiative consisting of academic institutions as well as UN agencies, FAO, UNICEF, WHO. And what we are doing is an interagency group looking at healthy diets in general and how do we come up with simple metrics to capture all components of healthy diet. Because at the moment, as I mentioned, the MDDW, the MDDC is a great tool, but it captures only diversity. I mentioned about 4 principles. So how do we get simple indicators for the other 3? And that the group is discussing a lot on that, and also coming up with manuals at global level on this. So with that, I would like to thank you very much, and I look forward to be part of the discussions.
Thank you so much. I am very much aware that after every presenter, you have some issues you'd like to clarify and everything. We're just going to have another presentation again from Dr. Stefania Gisipe from FAO on mainstreaming these tools. And after that, as she gets ready, if you have your notebook, you have a pen, please note down some things. We'll have time to have an interaction with the 3 presenters. So right now, over to you.
Thanks, everybody, and thanks for being here today, for those in person and also for those online. So in the next presentation, I will walk you through the FAO and country experience of bringing together the empowerment metrics and the minimum dietary diversity. So let's start with a quick overview. So under the umbrella of the 50 by 2030 initiative to close the agricultural data gap, FAO helps low and lower middle income countries to establish or improve their national agricultural surveys. So since 2019, we have been supporting 27 countries, mainly in Africa, as you can see from the map. And in 2023, under the auspice of the Gates Foundation and with IFPRI, we integrated the empowerment metrics. And separately, we added also the minimum dietary diversity module in 3 countries, Liberia, Sierra Leone, and Tanzania. So, but why we bring empowerment and nutrition together? So we have seen from Agnes that with the purpose of the empowerment metrics is to understand how empowered women and men are within farming households in terms of agency, resource, time, leadership, and autonomy. And the purpose of the minimum dietary diversity, as just explained by Akoto, is to assess women's nutrition by measuring the dietary diversity across the different food groups. So bringing these 2 together can provide an holistic picture of women's empowerment and nutrition, helping country to design a more evidence-based agricultural and gender policy that can strengthen equality, well-being, and ultimately food security. So what has been the activity objective? We have three main objectives, those strictly related to the statistics, those related to the methodology, and the final one which represent the champions. So related to the statistics, the main objective is to generate more data on empowerment, both for women and men, and nutrition for women in agricultural household. And this will give us the opportunity to turn data into action, to better inform gender responsive, evidence-based agricultural policy and nutrition policy, but also to strengthen the national capacity to produce more gender disaggregated and rural statistics data. So concerning to the methodology, our objective is to capture lesson learned, but also to fine-tune together with IFPRI the empowerment metrics, but ultimately through these 2 points to develop better training and learning material to support country teams to improve data quality and maybe to help them if they want to engage in these empowerment metrics. And our final objective is that of creating champions. So demonstrate to the help of the country where we implemented this WEN module, the feasibility and the added value of combining empowerment and nutrition, provide models and examples that other countries can adopt and adapt also, and inspire National Statistic Office to scale up gender and nutrition measurement within their survey system. So related to output one, to the first objective, we have different output. The first one, of course, relates to knowledge and evidence. Our output is that of having a survey report, anonymized microdata, which are disseminated for public use, enabling gender disaggregated analysis on empowerment, data diversity, and agricultural livelihoods, providing evidence to monitor and progress towards the CAP results framework, specifically the indicator 4.4 on women's empowerment, but also facilitating cross-country comparability, enhancing regional learning within the 50 by 2030 initiative. Related to output 2, as I mentioned before, we have the institutional strengthen, so enhancing national capacity to collect, analyze, but also interpret empowerment data and nutrition data. Promoting collaboration within the country between minister, agriculture, health, and gender, ensuring that gender and nutrition are mainstream into national data system. And lastly, strengthen the institutional learning to joint work on survey design, training, and analysis. Now, this is our journey to the Women and Empowerment module. We started in early 2024. I was not part of the team, but Chiara started in 2024 with the country engagement, where the women and empowerment and nutrition were adapted into the national survey together with the National Statistical Office and the Ministry of Agriculture. Then I joined the team. So we worked together on training of field workers, because as also mentioned by Akoto, both the empowerment metrics and the dietary diversity, they require specific training. And we also strengthen the collaboration and the feedback loops between the FAO teams and the country who adopted the WEN module. And then finally, in the late 2024, we roll out the questionnaire And later, our friend and country will go deep into that. So we roll out in Liberia, Sierra Leone, and Tanzania. We also supervise field operation and monitor the data quality. But at the same time, we provided technical backstopping. So for the whole 2025, and we are still at the end of this almost, we ran data analysis training. We review together with the country the preliminary result through joint validation workshop. We strengthened the national analytical capacity and confidence in using both the empowerment metrics and the nutrition module. And finally, we are at the stage of reports and microdata dissemination. And late, starting from today, we are at the final step with experience and sharing. So today we will share together, we will talk about all the lesson learned, the experience that we accumulated in this journey. We are talking also about the methodology refinement, and we are preparing all the learning materials. You want to take a picture? Okay, so I will go very short to the survey methodology because then our colleagues from the country will dig a bit on that. So just an important thing to highlight that the questionnaire related to empowerment metrics, women empowerment and nutrition was administered to a subsample of agricultural household from the National Representative Agricultural Survey, just to be more cost efficient. The interviews were run concurrently with the main survey. In each household, we selected the 2 women and 1 man covering the age 18-64, and those persons were selected randomly. For the women, we divided the women into 2 groups. We have the group of 1849 and the group of 50-64. Why we do this? Because, as mentioned by Akoto, for the module, the nutrition module, we cover the age 1849. But we thought it was also good to include the women of the, let's say, a later stage of age to capture empowerment across life stage while maintaining nutrition comparability. And we make sure that we had a high level of data quality because we make sure that the interviews were private and confidential and conducted without any proxy responses. Enumerator match as much as possible response and gender to ensure comfort and data accuracy. Also because in the empowerment metrics, there could be a sensitive question. So what we have learned from this amazing experience through the data crunching, once the data were available, that empowerment is the ability to make strategic life choices and control key aspect of the life and the livelihood. It involves 2 components, as mentioned by Agnes. So having the agency and the achievement, meaning that a person is able to make decision about the production, about the income, about the asset and its own time, but also how important is to having the resources to do this. So how important is to have access to land, to credit, to extension service, to be part of a member, and to have to share information. And through these 2 important components, we can define empowerment as both a process, like in gaining control, but also as a measurable condition, reflecting how much influence and autonomy an individual have across his own life and the domains of his own life. So briefly, when moving from data to transformation, we can say that empowerment is measurable and meaningful. The empowerment metrics demonstrate that empowerment can be quantified across agency, resources, and achievement, allowing country to measure it, but not only that, but also to track progress over time. We can say that empowerment and nutrition are connected and that context matters a lot. We have seen, and we will see later, that high empowerment aligns with greater dietary diversity, especially when it comes to animal source and micronutrient-rich food. We know that data could drive action. The women empowerment and nutrition turns gender and nutrition evidence into an amazing tool for targeted agricultural and social policy. And the integration into the agricultural survey ensure that results are country-owned, scalable, and sustainable. The way forward that will be explored much deeply tomorrow is important to scale up. It's important to deepen the analysis on how empowerment could interact with other important component aspect of agricultural production. And we must engage with more partners to act on the evidence, because you see the arrows there. With better data, we have better evidence that can lead to better empowerment and finally to better nutrition. Thank you very much. And if you want to scroll the code, there are a lot of information of our team, which is the survey team at FAO. Thank you.
Thank you so much, Stefania. Thank you so much to all our presenters this morning. And as I explained, people have some comments to make, issues to clarify, and maybe a question to ask. So this is the moment now. I'm inviting all of you now to take 1 minute to carefully think through what you want to comment on. You might want to write it down. And also remember the presenter and directly say who you are targeting your comment or to which presentation. 1 moment to be very careful and intentional on your question or comment. Then I'll open the floor for the contributions. All right, ladies and gentlemen, the floor is open for your input to the morning session. You have a question? Yeah. Yeah, go ahead.
So thank you for the presentations. Oh, so I'm Diana Lopez from the Gender Accelerator at CGIAR. So I have a quick question on the women's tool related also to the last presentation, is how you choose the man and women that should be interviewed. And because, from the ProWEA, it was the primary male and female respondents. But, here, based on your example, the respondents were randomly chosen. So what are sort of like the guidance in terms of who sort of be the respondents? Thank you.
I suppose that question goes to both Kwame and Stefania, right? Okay, you're not going to respond now. I'll take a few more, but just note it down for the response. Yes, please.
Hi, good morning, everybody. I'm Alessandra Gallier, and I work at the International Livestock Research Institute, ILRI, part of the CGIAR. I was curious to hear why you chose diet diversity out of the four, not sure what they are indicated, so the adequate, balanced, diverse, moderate. Why was diet diversity picked? Thanks.
So I think that goes to the dietary diversity, MDDW. Thank you. Please.
Yeah, thank you very much. I'm Hector Gankue, National Statistics Office, Malawi. Two questions. One related to the two consecutive presentations from FAO. The minimum dietary diversity had a minimum age of 15. This presentation, the last presentation, had a minimum age of 18. So my question is, are the WEN instruments not interested in the 15 to 18 age category? The second question is, in terms of the weighting of the, what should I say, dimensions or what? Where we had like 1/12 on each, where we had 12 components, maybe a third on other groupings, and maybe a quarter, etc. So I wanted to check. I know it's similar to how the weighting is done for computations of multidimensional poverty index, but I wanted to understand the drive behind equal weighting of these components. Thank you.
Thank you. Perhaps let me allow the presenters to address those. Then we'll have another round of comments coming. So I think, okay, you'll go with the one.
As I show in the presentation, the person selected for the WEN module, they were a subsample of the household already selected for the agricultural survey. So, and then those persons were randomly selected in each family, and it could be the household head or could be the spouse, so were randomly, as long as the age was within 18 to 64 for the men and also for the women. But of course, in some households, you can have one man selected and two women of the two different age, except in Tanzania, where we selected two different type of household, one for the selection of the man and one for the selection of the women. But within the household could be any other member in that specific age.
Were you not interested in knowing about the age group 15 to 18?
Can I come in on this? Oh, sorry. Just no. Yes, before we get to that, I just wanted to comment on this difference between the previous empowerment metrics that we have. So some of you may be familiar with the WEA tools. Agnes mentioned them in passing, the Women's Empowerment in Agriculture Index, which Diana alluded to. So this is measuring empowerment within households. So there are two interviews. The respondent is a man and a woman, usually a married couple. And it is a different tool because the goal is to measure empowerment at the household level. For the women's metric that's used here, we're trying to measure empowerment at the population level.
as well. And so embedding it in a national survey, that means that the respondent selection is different. So that's part the rationale for this process that Stefania just described. Should we go now for the age group difference? I was going to pass to to Jessica, my colleague Jessica, for that, because when we measure empowerment, we've tested these tools for adult women, and the age starts at 18, as you say. Now, of course, we understand that the younger women, in some cases, they are already mothers as well, and they also have other roles in the household. We are also interested in their empowerment, but we may need a slightly different tool for that. So I can pass on to my colleague for, yes, maybe Agnes wants to say more about this.
Part of the reason for choosing respondents 18 and above was for ethical reasons, because they're adults and can give consent by themselves. But in other situations, if they're younger than 18, they might have to ask somebody else to give permission for them to participate in the interview.
Awkwardly positioned for talking to the crowd. In addition to some of the things my colleagues have said, it's important to note that many of the components of women's, many of the component indicators have important age implications, ownership of a bank account, ownership of land, many of these things, depending on contextually where you are. An individual can't legally own land in many cases until they're of a certain age. The same for bank account. And then the control over resources components has an implication that individual is working, and we don't necessarily want to encourage child labor in one way or the other. And so those are all important components of why we're focusing on a working age population. And we say 18 to 65, and we haven't focused on validation in older age groups either, again, with this focus on the working age population.
Thank you. And then we had one question on the equal weighting. Why give it the same weighting? I think, yeah.
Yeah, the equal weighting is not me, but I'll just respond to some of the MDDW. I think the main one was if we are not interested in the other principles. Of course, we are interested in healthy diets in general. We are interested in capturing all 4 principles, but here we were looking for which one has a validated tool in a simple form that can be used. Out of all 4 is the MDDW that has been, in terms of diversity, that MDDW has been validated across context to be used for such global monitoring. The other ones have tools, but the way it works, you can have a tool existing in a research, I would say, arena, in quotes, but not necessarily in a program implementation or policy-making space. When you are doing a research 24-hour record, you can plan your resources to collect it. But if I tell a national government to do 24-hour record, we are talking of budget, we are talking of time, we are talking of this. It becomes very difficult to even implement that frequently. There are a few countries that have done that nationally, like say Philippines, Brazil. Some of them have done it nationally over time. But because of the cost involved, not every country collects. In fact, many countries do not. So here we were looking for simple indicators out of the 4 principles, the ones with validated simple indicators, and it's the diversity component. When it comes to choice of women in the household, it depends on the survey. Most often we go for what is best scientifically in terms of, if there are, for us, the age range is very important, 15 to 49 years as far as the woman falls within that age range. In this case, it was 18 to 49 years. It falls within that age range. We would have preferred that it was 15 to 49, the entire group, but as you can tell from the discussions, the survey was much more primarily driven by the women's empowerment tool, and then the diet diversity indicator was added on. We wouldn't say stop collecting it because we don't have enough data on women's diet globally. So every opportunity you can get to integrate that tool, please go ahead and integrate it. When it comes to the interpretation, that is when you need to look at the age range for which it covers. And if even it goes beyond that age range, there are some of the prevalence calculations, as I mentioned, 2 of them, which can be done for all age groups, is the threshold of 5 or more food groups out of 10. That is what has been validated for assessing micronutrient intake or adequacy of micronutrient intake within populations for women 15 to 49 years. Thank you.
You want to make a comment? Okay, please.
Yeah. So one reason, there are 2 reasons why we used equal weighting for women's. And one of them is that when you come up with an index, we also want the index to be something that can be used for policy communication. And we found that it was easier and more transparent to use an equally weighted tool because you know how much each indicator is contributing to the whole. And number 2, that's also the other reason is that to allow for international comparisons, it was easier to have a tool that had equal weights, because if we had the weights be determined within the data, for example, like the principal components, they would not necessarily be not comparable internationally. And so we just thought, like, let's keep it simple and comparable so that we can communicate our results more transparently. So thanks.
Okay. Thank you so much for those responses. I noticed there were hands. Second round, we have around 10 minutes. So, sir, you have.
Thank you. Thank you very much. Edwin Mane from FAO Rome. My question is for Agnes and Hazel on the first presentation. So with Chiara and Stefania, a couple of weeks ago, we met with the Italian National Institute for the Analysis of Public Policies, no? And we were discussing the women's. Their strongest point was on why we measured the intrinsic agency, no, the endorsement of women's freedom and the rejection of their subjection, why we measure it only for women. You mentioned it a little bit, but we've also found that it's quite important to see also how what is men opinions about it, and can we normatively impose that if a man, let's say, attitude towards those aspects is an asset for men's empowerment as well. So, or if you mentioned that the question did not work, can we design those questions better, like with vignettes or case, like a case to show that how men behave for those questions?
So thank you so much. I'm Winifred Ako from National Bureau of Statistics, Nigeria. So I just want to get clarification or best approach to getting the data concerning the methodology. The first question is on the reference period, the time period to collect this data. Is it over a 24-hour period, or was it yesterday as at when the person woke up until the person slept? Or is it a 24-hour period from yesterday till today? That's to Mr. Kwame. And then the second question is on the persons to interview to get this data at the house, in the household. The best approach is to randomly select, if there are about 4 or 5 women within the age bracket in that household, are you just interview all, or is the best approach to randomly select 2 or 3 from the 5 persons in that household? So these are my questions. Thank you.
Thank you. My name is Sylvester Maingi from the National Bureau of Statistics, Kenya. My question is to Stefania. In terms of the methodology, from the presentation, it is indicated as a sample of the agricultural household sample. So first question is this subsample, what is the recommended proportion of the already sampled size for the agricultural household survey? Then I know the focus on these questions or the module is on the agricultural households. But I wanted to ask whether it is possible to administer the same questions as a module to other surveys which are not necessarily agricultural households. Because sometimes the agricultural household survey takes quite a long time. So in between, when you are conducting other household-based surveys, is it recommended also to have a subsample of these questions in those other surveys? Thank you.
Thank you. This is Zahid Hassan from Bangladesh, a survey implementation firm. I'm just curious about to know, since it's a random sampling from 18 to 64 years population, men and women, for both diet diversity and for empowerment, have you tried to see how empowerment shifts or move from one domain to other domain, or food choices from one domain to one group to other domain as ages increases? I mean, because it's certain age has certain exposure to decision making. Same goes to the food choices also. That's just a question. I mean, curiosity, because since it's going to be estimated at the population level, and if it's not enough sample, not a large scale sample, it might give some distorted picture. That's what my question is.
Open the floor for respond. You had a burning desire to respond to that one.
I was being pointed at to respond. So, great. This is an excellent question again about the intrinsic agency measures for men in particular. And I think the thing we want to point out here is that intrinsic agency, so first of all, we did pilot those questions, include those questions for men in our pilots. So we have the data from the initial 4 countries. But conceptually, intrinsic agency is an internal sort of awareness of rights. So as a woman being able to say, I'm free to live a life where I make choices, that's, or live a life free of sexual harassment, those are sort of my internal awareness things clicking into place. As a man responding to those questions, those aren't responding to intrinsic agency. They're really interesting, and they're attitudes that men have about these key aspects of women's lives, but they aren't their own intrinsic agency. So we don't have intrinsic agency for men specifically in this regard. I hope that is clarification.
Thank you. Oh, you wanted to comment on. Please go ahead.
Yeah, I just wanted to maybe take the questions regarding sampling. So why we have randomly selected in the households and not and we didn't apply the questionnaire to everyone. Let's say that there are different ways, of course, of integrating a module in an existing survey. And there are different sampling design. We could have interviewed actually all people in the household. This was one of the possible sampling design that we could have adopted. However, when you integrate a module in a survey, I mean, most of us here in the room, we are statisticians, so we know what it means. You always have to take into account what are the consequences on the field work. So integrating a module on women's empowerment and nutrition in a survey that is already quite long about agricultural production needs to take into account also the respondent burden. If we had to interview all people in the household, the interview could have been too long, probably. So we have decided to spread basically our sample, and that's why we have decided the random selection of the individuals in the household. But technically speaking, we could have done the interview to everyone. It's just a matter of trying to match your sampling methodology vis-a-vis the context in the field, and let's say the concrete situations you have. Then very quickly, regarding the integration on in agricultural households. In the 50 by 2030 initiative, we work with statistical offices on agricultural survey. So our project offered a platform for integrating the module in agricultural surveys. But of course, as the colleagues from IFPRI can better explain than me, the module is suitable for being integrated in basically any type of survey, household budget survey, living standard measurement surveys, labor surveys, and so on. So it was just our platform that we offered.
The decision whom to select does not affect the interpretation of the results. Thank you very much. I'm seeing a hand, and I'm wondering whether all the comments that were raised have been addressed, because it's tea time. You want to answer? Okay. Ooh, the questions hereafter need to be written down. We have an online population audience that cannot stretch, and therefore I'm minding the time. So if
there was a question on the reference period, whether it's 24 hours, or I would say similar to what Kiara mentioned. We have something that we call respondent burden when you are at the field. You want to minimize that as best as possible. If I ask somebody from the time they woke up, it will be easier for them to recall than if I ask you since 2 p.m. yesterday. So it's just the reference point to ease the recall of the meals consumed. And it's a similar thing that is done when you are doing the reference 24-hour recall, where measurements are taken. So it's mainly to ease the respondent burden. So you ask from the time they woke up, that makes it easier, and the variation is believed to spread across the population.
You asked about whether this survey, at least women's, can be an MPDW can be administered to non-agricultural population, and the answer is yes. So women's, in fact, was designed to be able to measure empowerment regardless of livelihood category, because we all know that in the process of structural transformation, people are going to leave agriculture and work in non-agriculture, and we didn't want to lose people if we were only measuring it in agriculture.
Yeah, for the country where we implemented, we have statistics within categories by age, if they are female, male, and of course the subsample is national representative. So we had to also be in care about the maintaining the minimum statistically significant observation. But yeah, we run the analysis at different categories. Thank you.
Much for the morning session. It's now tea break. Thank you for being very participants, listening and contributing. Let us reconvene at exactly 11 local time.
Just maybe, sorry to interject. I think there was a small request from Joseph, right, to take the group photo right now instead of lunchtime.
Oh, okay.
Would that work with you?
We're now going to move to the lessons and early outcomes from partner countries. And I would like to invite Mr. Momodu Kamara, Head of Agriculture Section, Statistics, Sierra Leone, to come and give us your lessons and experiences. Mr. Kamara.
Good morning, all. Madam Chair, dignitaries from FAO, colleague participants from the National Bureau of Statistics, the ministry's colleagues from the Ministry of Agriculture, and other agencies present. Good morning to you all. Yeah. I'm presenting on behalf of my beloved country, Sierra Leone. It's just a small country in West Africa. Before going to my slides, Madam Chair, please permit me to thank and appreciate the Food and Agricultural Organization, FAO, for giving Sierra Leone the opportunity to integrate the women's empowerment and nutrition diet diversity into our national statistics. FAO, thank you so much. They gave us all the technical support and the financial support. So if I stand before you this morning to present on behalf of my country, it all comes from FAO. FAO, thank you. I am Momodu Kamara, head of the Agricultural Statistics. What I'm presenting, a part of it has already been presented by other presenters. FAO proposed the integration of an additional module. Remember, we have been implementing the 50 by 2030 initiative. And thanks to the World Bank, we started our implementation in 2023. Then in 2024, while we are implementing the production, machinery, and equipment survey, commonly called PME, FAO proposed the integration of this module into that survey. So the WEN questionnaire was attached as a module in the 2024 implementation, looking at the same households. So it's just a sub-sample of the national survey. And the national survey sample was drawn from the sample frame. And in Sierra Leone, the sample frame for the country is being controlled at the National Statistics Office. So provided from that sample, from the national sample of the most recent population and housing census, that was where the sample was drawn, about 5,200 households. And from that sample, a subsample of 2,525 households were sampled, and the sample consists of both adult household members aged between 18 to 64. Then the nutrition section of the questionnaire was also administered to other subsets of the population. And this subset of the population, 18 to 49, very important because it's the reproductive age group, then the 50 to 64. The WEN and PME agri survey questions were administered concurrently. How did it go? We're leveraging on the existing sample frame, as I explained earlier on, the sample frame of the National Statistics Office, the WEN data to agricultural household. We share logistics and also to streamline work, help harmonize data sets, and minimize costs by avoiding separate survey questions. The PME, which is the national survey, consists of 5,200 agricultural households. Then the WEN subsample from which this 2,525 was taken from the 5,200 households. While the PME looks at 10 households per EA, that's the enumeration area. Intervene one respondent per household, typically the household head. That's what the national survey was looking at. 10 households by EA. If this is the enumeration area, you just select 10 households. while the WEN targets 1 to 3 eligible individuals. And these eligible individuals got 1 man, 2 women. That has already been presented. So 1 to 3 individuals were interviewed per household based on the WEN selection criteria. Empowerment was assessed across 4 dimensions. And what are these 4 dimensions? We look at the instrumental agency, collective agency, agency-enabled resources, then intrinsic agency, claiming rights, mobilizing resources, engaging in community, and making choices. The first 3 dimensions were measured on both women and men, while intrinsic agency was measured exclusively on women. Dietary diversity. This is very, very important proxy, as already presented by presenters. The micronutrient intake was also assessed only among women. Even though the selection consists of 1 to 3, 2 women, 1 man, but the dietary diversity on micronutrients was also assessed only on women and not the man selected in that EA. This is just a snapshot of the results. After the data was implemented, the data was collected, analysis, you observe that 93% of women in Sierra Leone are disempowered. And constraint is 59% after the weighted indicators. That gives us what? A score of 0.6. So when you look at the score of 0.6 compared to men, 78%, those constraints 57, with the weighted indicators, gives you a score of 0.56. So if you take the difference, 0.56 for men, 0.46 for women, then you observe that there is a 10%. So moving further, you observe that no agency not empowered from 0 to 0.3. Then those are partially empowered. Then we have substantially empowered, which is 0.5. And those highly empowered is 0.5 to 1, which is fully empowered. A consistent of 10 points gap from a score of 0.46 to a score of 0.56. So you see the gap in empowerment reflecting persistent inequalities in agency and access to resources. I don't know whether this obtained in other countries, but this actually was our results. And when you look at this result, it actually reflects the situation on the ground. Because of traditions, because of customs, so our women are not equally empowered compared to men. The rate of disempowerment. We look at the national level I've just presented is approximately 92.6 compared to 77.9 for women. The blue there is for men, while the green is for women. So at the national level, you observe that 92% or approximately 93% compared to 77%. And when you go to the eastern part of the country, it's 91, almost compared to 79.8 for men. Then the north, 98.1 compared to 89.8% for women, sorry, for men. And for men, for women, in the northeast, it's 95.4 compared to 57.4 for women. So for men. In the southern region, the women 86.6, men 80.3. Then for the Western rural districts, remember why Western rural and not Western urban? Because the answer is it's an agricultural survey. And we only selected EA's enumeration areas that are in the rural setting. Because most of our agriculture in Sierra Leone is being done at the rural areas. So that's why we have Western rural, even though we have Western urban as a region. But not much agriculture is being done in the Western urban. So in Sierra Leone, women's disempowerment is pervasive and systematic. Nearly all adults 18 to 64 years, women living in agricultural households are disempowered. So let us all know that these results that we are projecting here is only for women living in agricultural households. It's 93% for women, and men are less affected by 78%. Women's disempowerment is broader and more heavily distributed across all empowerment domains. You come and see the domains in my next slide. Then men's disempowerment is more concentrated in public facing and financial autonomy. What drives empowerment? So if you look at the graph there, you see women's safety, community confidence, digital, then organizational leadership, financial agency, time agency, health autonomy, and family autonomy and livelihood autonomy. So if you compare, so this one, for men, women above there, compared to men, let's look at the first one. You observe that for women's safety, or let's look at financial or credit access. You look at financial inclusion. While this financial inclusion agency, you have 0.45. Then if you come down, you look at financial inclusion, 0.38. So you can see the disparity between the autonomy that drives women's empowerment. You will also look at what men's empowerment is driven primarily by financial control and leadership. Looking at the domains. The key findings and other characteristics. The MDDW, then those women that are able to consume 5 or more foods out of the 10 classes of food. So we look at the literacy, we look at those women that are literate, 81%. Then for the food group diversity score is 6.4. And for high literate women is 72. And the food group diversity is 6.3. In terms of residents, we talk of the urban and the rural. Remember, out of the EA selected in the rural setting, we also have women, agricultural households that are in the urban areas. So when you compare the rural and the urban, you have 79.3% compared to rural women with 73.1%. And when it comes to the food group distribution, the food group diversity, you have 6.1 compared to 6.4 for men, for rural. Then in terms of education, we try to look at those educated women and those illiterate women. Those none for 72, the primary, that's those that attain primary level, and those that attain secondary level, 79.91%. Then post-secondary is 73.4. For the food group diversity score, 6.3, 6.3, 6.4, and post-secondary 6.6, which is the highest. So in summary, the literate women are more likely to achieve dietary diversity, 81%, compared to illiterate women with 22%. So women living in enumeration areas as urban have higher MDDW prevalence, 79.3, compared to those in rural EAs, 73.5. The result also shows that women with any education reported, be it higher prevalence, 79.9, 79.1, and 73.4, compared to those with no education at all level, which is 72.6. Key findings continue in terms of consumption. These are the food groups that we look at. They have been earlier on presented. So we found out that for grains, white roots, and tubers, for us in Sierra Leone, the percentage of women consuming that food group is 98.7. Then when you look at the groups also, you found out that the lowest is milk and milk product, 13.8. Sorry, so for eggs, is the lowest, 9.7. So there are reasons for that, why our women in Sierra Leone consume less of eggs, less of milk and milk products, then coming down to other fruits with 31.9. Overall, grains, white roots, and tubers were the most consumed, followed by meats and fish products, and dark green leafy vegetables. Because of time, I'll just give you a clue. Why is it so for Sierra Leone setting? Sierra Leone is an agrarian economy because agriculture contributes almost 50% to our GDP. And most of our women are farmers. They grow these crops, the white roots, the tubers, the plantains. There are so many in Sierra Leone. So they spend less, they consume more of them. For the eggs, dietary products, and other fruits remain under-consumed in the country. That also is just, I just want to digress a little, because of it's not produced much, and the cost attached to this product. So women consume less of these food groups. Oh. Okay, let me just round up. The study reveals that empowered women are more likely to meet their MDD threshold, while results showing statistically significant difference. Women with adequate dietary diversity had a mean empowerment score of 0.8 and 0.2 for those who did not, indicating a positive association between empowerment and dietary diversity. Okay, lessons learned. This is the most important part of my presentation, because the result, the lesson learned, enumerators, coordination, and deployment. So for those countries that are yet to integrate this module into their national surveys, careful planning is needed when matching the WEN and the agric survey, as misleading workflows can cause delays and unnecessary downtime. Then preparation and timing. Strong planning, well-structured training, and thorough pre-testing of tools contributed to a smoother fieldwork and improved data quality. Importance of female enumerators. Why are these women important? Female enumerators play a vital role in building trust and ensuring confidence, especially for those questions that are very much gender sensitive. We know that traditions and customs, because of time, I will not go in details into that. It's very important. Managing respondent expectation. Sierra Leone just came out from war for 11 years. So whatever questionnaire or interview that you conduct, our respondents, the expectations are high. So you actually need to educate them so that they will understand the importance of the survey. So these are some of the lessons learned. We are almost coming there. Recommendation for future rounds. Our recommendations in Sierra Leone, when you want to integrate the WEN into our national surveys, optimize data collection timing. Conduct of data during what we learned most. We integrate this WEN survey into our national surveys during the rainy season. And we have two seasons, the rainy season and the dry season. The rainy season spans for 6 months, while the dry season spans for 6 months. So because of the integration during the rainy season, field staff encounter a lot of problems. Some EAs were inaccessible, but because of those problems, as coordinators of the WEN, we have to spend extra resources so that enumerators will be able to access those respondents that are in areas that are inaccessible because of the rainy season. Strengthen technical expertise, include trained nutritionists. Yes, that was another recommendation, even though trained nutritionists were part of the training. But in terms of data collections, they were not part of us, only very few, because of their engagements and other issues. Then clarify deployment protocols. We should avoid unnecessary integration of WEN and agric enumerators unless operationally justified. Why? Remember in my first slide, the agric enumerators are administering their questionnaire to 10 households in one EA. Then that involves field measurement, while the WEN is looking at 1 to 3. So the timing, if I'm WEN enumerator, the time involved, finally. I want to thank you so much for your kind attention. Thank you, Madam Chair.
Thank you so much.
You're welcome.
Yeah. That is the experience, very rich experience from Sierra Leone. I would like now to invite, as the next speaker comes, take your pen and paper and jot down whatever is striking you that you might want to voice afterward when the time comes. So I'd like to invite Mr. Momo Bobor Kamara, Assistant Director for Agricultural Statistics of Liberia Institute of Statistics and Geo-Information Services, to share with us the experiences from Liberia. Thank you.
Thank you so much. Mr. Bobo Kamara is already here. Thank you to my colleague, my close neighbor from Sierra Leone. Allow me to stand on existing protocols. I'd like to express my thanks to FAO for all the support through the 50 by 2030. So I'll just go straight to my presentation to jump over time. My name already said, I'm the head of agriculture statistics section at the NSO in Liberia. Then I also coordinate the Liberia Agriculture Census Program, which include the survey. So this is just a short plan for the presentation. We have a short introduction. We have key results, constraints and challenges, lesson learned, and recommendation, and then we just have a conclusion. The 2024 Agriculture Sample Survey, which actually the sample now supposed to actually be there, which integrated the women empowerment and nutrition, but to capture the status of women empowerment and dietary diversity in agriculture household. The model targeted women and men aged 18 to 64 living in agriculture household. The goal is to promote evidence-based policy making by linking women agency with nutrition outcomes and strengthening national capacity for gender statistics. So my presentation will actually focus on lesson learned, some key results, and then how the results reflect the situation in Liberia. So our survey was a sample survey. As you know, the integration of WEN was done with the annual agricultural survey, and then this survey was a subset. The targeted population was a subset of the annual agricultural survey. So the good thing about the survey is that the women empowerment also targeted agricultural household, which made it more simple for the enumerators. So I will go through the key findings, but because they are already available, there are reports that you will be able to refer to. I will not go through them all in all, but I will just hit a few points. These are the key findings on empowerment. Average empowerment for women 0.4 lakh, 0.47, and lag behind men 0.59. About half women 5.3 are disempowered, facing multiple stimulus constraint as mean intensity. we will look at these are lists of food groups, and then I will just focus on one key point, few key points there. The table that is in the middle, the key findings dietary diversity. 54% of women met MDDW. If you see the staple up there, root grains, we see the percentage of women, which is 94%. This result is glaring. That food group consists of a specific food that is the staple of our country, rice. And then rice is normally grown in almost every agricultural household. So that is why it's highly consumed in my country. If you ask a Liberian whether he ate a lot of other food like egg, he ate beans, he ate even ice cream, chicken. If you ask him, did you eat yesterday or did you eat today? Once he have not eaten rice, he will say he have not eaten. That is the problem with Liberia. So once we don't eat rice, it means we have not eaten. So that's the reason why you see there's 94%. Then the lower side of it is egg. Egg is lowerly consumed, around 12%. You see dark green, dark leafy green, which is 56%. Most farmers, including people who do backyard gardens, normally grow greens. So they normally consume what they grow. And for rare palm oil, which is in a category, in our country, we consume a lot of oil. You see the percentage at 78% of women consuming rare palm oil. So like small insects and small proteins consumption are very low. It's at 6%. So there are a lot of in-depth statistics on these key findings. We refer to the report and we will get them the clear and in detail information. So, and also these findings on empowerment, also empowerment of women and on the skill. Up there we have findings from women empowerment, claiming rights. 35.7% of women fully endorse in women's rights and choose economic activities. And then making choices. So only 27% of women exercise strong influence in spending decisions compared to 38% of men. So engagement in communities. So has 70% of women expect strong confidence in women community empowerment. Okay, so let us go to the regional demographic, which I want to stress on. Women in Monserrado and educated women report higher nutritional intake. This shows that the dietary diversity among women who are educated are high. So Monserrado is the capital of Monrovia, where population there have access to more immunities. There are more immunities in Monrovia than any other part of the country. So as I said, the report is out. The report is out, even though nationally have not been launched, but these statistics can be available and you can check and then find them and read them in depth. So I would now go to the constraints. There were a lot of them. We'll only try to put them in a little short term. So one of the constraints that we face nationally in implementing this was the difficulties in contextualizing some WEN questions. We started this WEN training in collaboration with other institutions, the Ministry of Gender. We have the Social Protection Units and the Ministry of Health, Nutrition Division, the Ministry of Agriculture. The training started on the national level, but when we went to the field training level, we were not able to incorporate some of these staff that will really help to contextualize the question. And then secondly, there was no time. You know, we were in the middle of the census program, and we were engaged to be part of the piloting of the WEN. There was already a questionnaire
which was already designed for the implementation of this annual agriculture survey with specific module, the income, labor, and productivity. We were supposed to conduct the income, labor, and productivity, which was the first module under the agriculture census program. So we integrated the WEN, and then, as you may know, the WEN enumerators have a targeted population, even though it's a subpopulation of the agricultural household, but they targeted certain household members, and sometimes those household members selected by WEN are sometimes selected for crop cut. You know, it was a combined survey. So when asked the question, the way we approach the household is that the WEN enumerator is always the first to do the household roster. The WEN enumerator do the household roster and then gather some information and then transfer it to the other enumerators to do the other part. So sometimes if an eligible person for the WEN is also an eligible parcel that need to be measured, it sometimes brings some issue. So that's the reason why time was one of the major. So if you notice during the survey, we had only one visit, which was not very good. It also play on the sample. It has some issues that if you go to a household and someone is eligible, you know, the eligibility is done automatically when the household roster is done. When the age, sex is recorded, the copy automatically select the eligible persons. So the enumerator don't have control over that. So if the person will not be available, it sometimes create time when we have one visit only. So also we have some issue with tablet malfunctioning. You know, as I said, when enumerator was responsible to do the household roster with certain variables like age, sex, and other variables, and then later on transfer to the other enumerators for the other portion of the questionnaire. So we face problem with Bluetooth transfer. There was serious issue with Bluetooth transfer, and enumerators have to end up doing manual entry. That this constraint was major. Amidst this constraint, we learn some lessons. What did we learn? That the WEN questionnaire can effectively be integrated into the agriculture survey as a separate module, which can save time and reduce respondent burden. The duration of the agriculture survey in Liberia requires at least 2 or more days for accessible EAs and 3 days for hard to reach EA. In Liberia, we have what we call accessible EAs, which can be reached by motor vehicles or sometimes motorbikes. We have EAs that cannot be reached by foot. So when we did this survey, whether it was EA that is hard to reach or EA that is accessible, the time allocated was only 1.5 days. Actually, maybe someone will ask whether there was not a pilot done. There was a pre-test done, there was a pilot done, but in our country, the agricultural survey, the harvest season is at 2 periods in different regions. So we do some regions in July, August, September. You know, the agricultural survey is done when we are harvesting. Why? Because we are doing also the production surveys. The production portion is the key, is the core of the survey. So we normally do the data collection when harvest is going on. So harvest period in Liberia are 2 seasons. So if you send enumerators in the first phase and you send enumerators in another phase. So when we were doing a pre-test, the pre-test of this questionnaire was done when there was no harvest, especially for rice. So we pre-tested the questionnaire, yes. We pre-tested when enumerator went to the household, they had harvest to do, they did the WEN questionnaire pre-test. But then the downside of that pre-test was there was no rice to be harvested. And a major crop harvested during the real survey was rice. So it was tested, but then cultivation was not done. So we did not include identification variables in a WEN and an IFPRI questionnaire, which is necessary for merging 2 data sets. Because of the error, we are able to analyze the relationship between empowerment and productivity. So now we only do empowerment and nutrition. So to do in-depth analysis of nutrition, whether nutrition is empowerment is connected to productivity, no, we cannot do that. We did not include a variable that we can capture that. So the conduct of an integrated WEN require more dedicated staff with special roles. So we will need in the any survey to come to include staff, especially those from the Ministry of Gender, that those terminology related to empowerment, the other thing that will be able to explain to enumerators that they will have to be part. Actually, they were not part of the training of enumerators. They were actually part of the general training of the WEN when we were introduced to the bureau. But when we went to the level of training enumerators, they were not actually part. So we saw that as a lesson learned, and we have to include the Ministry of Health, Gender, and Nutrition group. They have to be part of the training at the field level, even the monetary level. So one visit of data collection is not feasible. I talked about that already. One visit is not feasible. If you visit a household and found out that the eligible person is not there, you should be given another time to do recall. Then future survey should have contingency to minimize the impact of administrative delay. Those administrative delays, sometimes, this lesson learned is mainly connected to the other part of the funding agency. The agriculture survey was funded by the World Bank, and then the WEN was funded by IFPRI. So, and the enumerators went to the field together, and they had to be paid together. So when one agency delay payment, it affects the other agency. Yeah. So then recommendations. The number of days of training and data collection should be increased. More days should be allocated for stimulation, enable the contextualization of the questionnaire. Increased number of technical staff with specialized area, nutrition, gender, and learning empowerment. Future surveys should consider including unique identifier for both WEN. This will facilitate in-depth analysis, example, empowerment and productivity. The copy tool should be tested way ahead of schedule. So these are how they are related to the labour contest. Farming household rely heavily on staple crops. It was shown by the data. And then women perform major farm labor but lack decision-making power. Low empowerment hinders productivity. Okay, that's not so good. Okay, gender gaps reflect broader structural inequalities. And then nutrition patterns show financial constraint and limited resilience. So thank you very much for your attention.
Thank you so much, Mr. Kamara, for the experiences from Liberia. Please take down some notes and issues you might want to make a contribution to that experience. I would like now to invite Madame Noor Masood, the Production Statistics Manager, Office of the Zanzibar Chief Government Statistician, to share with us the experiences from Tanzania. Over to you.
Good morning, ladies and gentlemen. As I've been introduced, my name is Nuru. I'm the Manager of Production Statistics from the Chief Government Statistician. I'm here to present the WEN experience in Tanzania, of which so far we have not yet disseminated our results, but at least we will tell you what happened in brief, so to see how we conducted our WEN survey. So Tanzania, we have been recognized the importance of women in the society, but yet we did not have enough data as the evidence for this empowerment situation for women in Tanzania. So last year, we had a chance to integrate the WEN module in our ASS survey, which we are conducting under 50 by 2030 initiative. So it was a model in the main questionnaire. So we had a chance to conduct this survey. So this survey was supported by FAO and World Bank under the 50 by 2030, as I said, and Bill and Melinda Gates Foundation. Also, as you know, Tanzania is between mainland and Zanzibar. We had a collaboration, we worked together, again, with other stakeholders and other members of our technical team.
And this survey was very successful because the field staff enumerators and the technical team were so much dedicated to ensure this survey becomes very successful. These were the objectives obtained for this survey, for its integration. What we wanted to do is comparing the empowerment of adults, men and women living in agricultural households. We also wanted to measure women in streets, agency, decision-making power, and access to resources. We also wanted to link the empowerment indicator directly to dietary diversity and household nutrition, strengthen evidence-based for policy making, gender-responsive programs. We also wanted to align with SDG goal number 5 and nutritional gender commitments. Also, it was aimed to improve the availability of gender-sensitive agricultural statistics. So these are some of the information collected, and I'm sure this was also mentioned by other members because we had the same questionnaire, I guess. So these were the information collected. That include participation of women and men in unpaid and paid activities, decision-making at household and individual level, awareness of rights and perceptions of gender-based violence, access to financial services, property credit and ICT, community participation and leadership, and women dietary diversity for 20 hours, 4 hours per group. So this is how we designed our model. So this is our domain. First, it covers, at the national level, it covered mainland and Zanzibar. Then with that, in Tanzania, we have 31 regions, of which 26 regions were in Tanzania mainland and 5 regions were in Zanzibar, of which all of them were involved in the surveys. Then those were urban, there were urban and rural areas. So there are 2 subsamples that interview men and women separately. So we target women 18 to 64 years and men 18 plus. So that independent subsample of households were drawn. The subsample A was for men, where 1 man, which is between the age of 18 to 64, was randomly selected. From the mainland, we have the selected men from a total of 2,250. And in Zanzibar, we have selected men from 550 households. So for subsample B, we selected women randomly, 1 woman 18 to 29 and 1 woman between the age of 50 to 64. These were randomly selected. And for this, the sample in Tanzania mainland were 2,400 households, and Tanzania Zanzibar was 550 households. So these were the lessons learned during the training, during the survey. So we saw there was a need for continuous training and capacity building for this gap. We know WEN is, for WEN questions, they are quite sensitive, especially in our culture. It needs understanding, it needs patience, it needs listening, and it needs to know the way of expressing the question so that the society takes it positive. So there's a need of deep training to make sure this work is conducted as we are planning. We also need community awareness and sensitization. For the field work, we found out when you are interviewing a person, when a person understands a question very well, they can give you a very good answers. So the community have to get the awareness and should be sensitized. So in order to make sure that the information they give is correct, corresponds to what we are asking. We have seen also the importance of coordination and collaboration across agencies. With this survey, we have worked with the Ministry of Women, nutrition specialists from different Ministry of Health, Zanzibar and mainland. So it was easier because for them, they have experience on women issues. So if you have collaboration during the survey, it's easier to collect information. So there's a need to engage them during the survey. And other thing we learned its logistical challenges. Last year we had little bad experience because during the survey it was a rainy season. And again, we had a problem of landsliding in some of the country area. So it was not easily accessible during the survey. So I think we should plan better to make sure we cover these challenges before we continue with the survey to make easy implementation of the survey. So along the journey, we also had the achievement. So we had generated the national generation of nationally representative gender nutrition evidence. With the data we have collected, we have now the evidence of what is on the ground. Then we have also now have the strong coordination between these ministries of between the stakeholders, the people who have been working together. So it was very successful because of their participation. And now it's easier, like when we want to conduct another survey, these people can help us with the advice and other things we want to take on. And the cooperation between the field workers and the respondent. The field workers during this survey, they had a very good cooperation with the respondents. Respondents were easily answering questions for the field workers. So it was easier because we had those sensitization, we made awareness before the training, before the field work was conducted. So it was easy. And we also worked with the local leaders. So our field workers conducted this survey very easily with no problem at all. That's a small experience about Zanzibar. Here is our chief statistician when he visited the field. Thank you very much.
Thank you so much, Madam Noor, for that experience. And for all the experiences, I think we're really getting a lot of commonalities around things that were successful and the challenges that were experienced. I'll just allow 5 minutes for anything, point of clarification. We are continuing with the same group of people sharing with us their experiences. Unless there's something burning, I would like to move us into the next session. I'll be asking specific issues for them to respond to. And perhaps after that, we may then open up, if time allows, for further detailed discussion and conversation. Is there anything really, really burning? And my, salt checker is running.
Thank you, Madam, and thanks to all the presenters. Please, my question goes to Tanzania. I would like to find out from them whether they separated the WEN questionnaire from the agriculture survey. Thank you.
Okay. Tanzania, did you separate the WEN and the agriculture survey?
Thank you very much. My name is Angela Kimani from Gates Foundation. Maybe some questions I'm sure they'll be answered in the panel, but maybe a specific technical question for Liberia, because they mentioned the challenges of the malfunctioning tablets and internet, Bluetooth transferring. Was this a general problem also with the agriculture survey, or it was just for the WEN component? Were these tablets general for all the surveys, the whole national survey? And then also for Tanzania, I think it would be great to know a bit more about your recommendations moving forward, because I might have missed that.
Right. And with only those, I'll go first to Tanzania. Within a fifth of a minute, please respond to the 2 questions. The first question, did you separate between the WEN and the agricultural survey, right? Did I capture that well?
Thank you very much. The first question, we integrated the WEN and ASS questionnaire. The ASS questionnaire was a module. The WEN questionnaire was a model in a agricultural survey questionnaire. So what we did, just brief. Okay. Okay, with the ASS questionnaire, some of the household were selected randomly to answer the WEN questionnaire. So not everyone in every agricultural household, but some the selected agricultural household.
Thank you. I think you've responded. In a fifth of a minute, the question was about the challenges. Were they specific to the WEN or global?
Okay, thank you. So the challenges of the Bluetooth that are related to the tablet were actually for the WEN. Yeah, it was specifically for the WEN. Yeah, the WEN enumerator will have to transfer the household information to the other component. So it was specifically for the WEN.
Thank you. And I think for the recommendations from Tanzania, we may get them from the next session that is coming. Unfortunately, I'm getting more and more challenged with time, so I would like to invite the same speakers to please come forward. We're going to have a very short session. Tanzania, Liberia, Sierra Leone. They are our same panelists. You're most welcome to the front. Thank you so much for sharing with us your experiences from the 3 countries where WEN was administered alongside the agricultural production surveys. For each and every one of you, I have 3 very, very straightforward questions, and I will take you through. I have modified them a little in the interest of time. Now, for each and every one of you, the WEN survey was incorporated into your national agriculture surveys. We have learned from your presentations that generally, of course, with some of the challenges you have highlighted, the experience was smooth in all the 3 countries because we've learned about the valuable lessons you picked. Now, given that, the first question is, what was the main factor that enabled such success? And I said the main because there may be many, but I would like you to sift through and tell us the major factor, success factor that enabled you to get the data and experiences that you did. And then please tell the audience the number 1 biggest challenge in your view. And lastly, you will share with us the main steps, not a whole list, maybe main global 3 to 4 steps, which you feel are required to integrate this module within the surveys conducted regularly by the National Statistics Office. I heard somebody say, is it only for agriculture? Is this WEN only helpful for agriculture surveys or others? Please tell us. So those are the 3 issues that you would like you to share with us, with the audience. And we'll only have 1 round of presentation in the interest of time and allow you only strictly 5 minutes. Okay? Thank you very much. I would like to begin with my neighbor here. Thank you.
Thank you very much, and thank you for the 5 minutes you have given me. Okay, enough. So the success of this survey was caused by the cooperation we had with the with the stakeholders who are working with the government, the policymakers. So, and the government, local government we worked with. So because we have worked with them from the beginning of the survey, it simplified the process of data collection. So when we went to the field, it was easier for us to collect information. The other things, the challenges that we had, we didn't really have the challenges apart from like the time of training, as I said. These questions need larger time. Like the people who collect data on sensitive issues like women should be trained more, should be giving more time to make these people they are collecting data from free to give the information they're supposed to give. But again, another challenge I see is like this survey was only covered in agricultural population, not the other population. So we need so now we have the information on women empowerment only in agricultural sector, but not in other sector. But it would be better if we know the situation of women empowerment in other sectors as well. So for the recommendation, as I said, we need extensive training for such surveys to make sure the field workers understands more about the question and they know how to deal with this society of women. Also, we need awareness. The awareness we built, it was not so much, but again, we have to build enough awareness for the society where we are collecting data from, especially in African society, like collecting data from women who are like sometimes married or in a society. It's not easy. We need like women to women and men to men in such situation. But yet you need to be keen on when you're asking questions to them, and you have to probe more to know what they're telling you is what you need to hear. And the other thing, we need to have a continuous collaborations with these people, Minister of Health, Minister of Women Welfare, and the local leaders to make sure the survey becomes successful. And the last thing I said is like, we need to incorporate this survey in other surveys, like household surveys, in labor force surveys at household level, where we think we can cover everyone in the society, every woman in the society. Thank you.
Thank you so much. Those are really spot on. The collaboration, the partnerships were very helpful, and thorough preparation is extremely important. Mr. Kamara from Liberia, would you kindly share with us, or along those three lines, success factor, the major one, the major challenge, and 2 or 3 major steps you think can be helpful to integrate this module within surveys in your country?
Thank you very much for the question. I like to put it this way. There are several enabling factors, but I will just go strictly to the key important one. One of the factors that enabled us to implement this survey was they were already structured in place. When I say structure, there was an agriculture survey team already in structure from the agriculture census. There was a sample already made, a sample size for the survey. And then key among them was the WEN and the IFPRI and the crop model. They are all targeting agricultural households. So that was the key enabler. The WEN is targeting agricultural household. The IFPRI agricultural household. So enumerators were going one direction. That was key. So we don't have a sub population. We have to find the other population the other day. So that was one of the key enabler. So our key constraint was time. We had issue with time at several levels. We did not have time to train enumerators on how to contextualize those questions. Those questions had really to be contextualized, not to change the meaning of the question. So time was one of our major issue. Even at the data collection level, we did not have time to even follow up on eligible respondent.
given the time that was allocated for the enumerator to stay in an EA. What we can really do for future, just few steps we can take. We will have to institutionalize the data collection of women empowerment. When I say so, I mean get on board now the Ministry of Gender, gender issues. Our staff from the Gender Ministry will know better how to contextualize a gender-related question than a statistician from the NSO. So the collaboration with all our stakeholders is key. We have to collaborate. Collaboration is key in planning the future WEN. I would like to stop here. Thank you.
Thank you so much. Having systems in place, having the same kind of direction where you're going to do to target your research, and then thorough preparation, one of the things that you're pushing for. Thank you so much. Mr. Kamara, please respond along those 3 lines: the major success, the major constraint, and key strategies for integrating this beyond the agriculture. Thank you.
Thank you very much, Madam Chair. I will start with the major successes. You talked about the major factor. Well, in response to this, I will decide to blend. So our major factor in Sierra Leone was the resources and the inclusive or effective coordination. Why I mentioned resources as the major factor, for the past 20 or 30 years, we have not been able to conduct surveys of this type until when we receive support from FAO. So it's a major factor. So because of the availability of funds, we embark on inclusive coordination, inclusive partnership involving all stakeholders, both non-state actors who bring them on board. And the unique thing in our country, we have a close collaboration with the Ministry of Agriculture. We have an MOU that whatever survey or census that we conduct, they are our partner. The WEN survey is so sensitive. So what we did, a part of the effective coordination and partnership with all stakeholders involved, we even went to the media. We engaged most of our radio stations before the implementation of the data, before the actual data collection, to sensitize them, to know about the WEN survey. We need a buy-in. So before even the data collection, we already have the buy-in of both our local stakeholders and our policymakers. So that's brought us to where we are. The effective coordination between MDAs, agencies, the involvement of other stakeholders, that non-state actors that are advocating for women's rights. All ministries, the Ministry of Social Welfare, Gender, and there are other women's groups that are fighting for 50-50. So we bring them all on board. So we are able to embrace the WEN survey. Talking about the major challenge. With all the successes that we receive, training our enumerators, going to the field, the major challenge, as I earlier presented, was the rainy season. Why it's a major challenge? Because we budgeted for our enumerators that they would be able to visit all EAs. But even though they are able to visit those EAs, but it also involves cost. So we have to provide additional funds. But part of them going to those inaccessible areas, we want their safety. But we did not budget for that. So we have to provide extra funding, wherein it requires hiring a boat to ferry them across, wherein it involves hiring a vehicle or a motorbike to take them along. And some even have to spend more than the required days, but that all involves paying them extra. So that's why resources was the major factor that enabled us to actually take us where we are today. Then come again. The other question that you asked, how can we integrate this module into our service? First of all, I will not talk of resources again because resources also is another thing that we should always consider. Because surveys, conducting surveys and censuses is very much expensive. This is why not all countries are able to conduct surveys and censuses. And our governments cannot fund regular surveys. So if the resources are there, coordination should also be another factor. We cannot work in silos. We need the Minister of Agriculture. We need the Minister of Gender and Children's Affairs. We need the 50-50 groups. We need those NSOs that are advocating for women's rights. We need our respondents. They are very, very important. We need to sensitize them so that they will know about this WEN survey. Then another factor, the selection of field staff. Those that, you have this field staff, but the training of this field staff so that they will be able to conduct the survey easily. Then the other thing is also think about the tools that we use for the data collection. It should be user-friendly. Remember, we are living in countries that are very much internet connectivity, that. So implementing a survey should be user-friendly. So when my enumerator goes to the field, in case there are no internet connectivity, the application should enable him to collect the data easily, so that when he or she comes to a coverage area, he will be able to synchronize the data. That's also we should think. Then another factor, proper monitoring and evaluation. You need to monitor them, even when we implement. That was the unique thing during our implementation. The FAO experts were with us. So even when our enumerators synchronize the data, our experts in Rome, our experts in other African countries like Ivory Coast, they will straight away know enumerator is unable to, this enumerator has left us 1 or 2 enumerators. So that, in fact, also enabled us to take us where we are. So thank you so much.
Thank you. This is really, really educational, educative in terms of giving us hands-on experience, hands-on tips, and issues on how to, even as we think about scaling these tools for other applications. The floor is now open. I have about 10 minutes for the audience to make your input. Remember, they made the presentation, we had a little bit of questioning, but now they've even shared more, giving ways forward, tips for success, how to deal with challenges. The floor is open now. Yes, please.
Thank you very much. My name is Julius Mundia from Association of Women in Agriculture Kenya, AWAC. I'm quite concerned about a certain emerging demography, and this is about single-parent households. Because in Kenya, the statistics say that we have around 40% of the households is single-parent households. I don't know how women empowerment and nutrition can be affected if we decided to consider and disaggregate also that demography and see how it can turn out. I don't know whether in your countries you have that problem, but I think in Kenya we are having that very crucial demography. Maybe from the designers, you can give us an insight on that. Thank you.
Thank you. I think that is more to the designers, the initial crafters of this tool and this initiative. Yes, I see a hand there. Yes, Madam.
Good afternoon. My name is Hilda Kegode with C4IFPRI. My question regards the seasonality because I do understand the challenge with the rainy season, not just the logistics, but also the availability of respondents who are maybe out in the field doing their crop production activities. However, we realize sometimes that during this season of crop sowing, weeding, and the preparatory land activities, that period also coincides with low food availability because it's way past the harvest season. I wonder if we constrained ourselves to measuring these indicators during the dry season, as the presenter from Liberia suggested, will we completely miss out on those indicators during such periods of low food availability? Thank you. And how that impacts policy decisions.
Thank you. That's a critical question. The timing in terms of food availability seasons. I see 3 hands, the gentleman, the lady here, and the 2 ladies who are neighboring each other. And one other person I saw, and that will be it. Yes, the gentleman there. Unfortunately, that will be it. So,
yeah, this is Jahid Lassan again from data. I had 2 questions, but one is already asked by the seasonality part. It's related to timing, but 2 partner countries says that time is a challenge, big challenge, especially for training enumerators. And if we understand from the tool developers, the WEN tool averages takes 15 minutes, and the diet diversity tool, I guess, take about 8 minutes at most. So how much time you think from your experience requires to train the enumerators to implement this survey with efficiency and accuracy?
Thank you very much. This is a question to the 3 countries. In future, do you intend to integrate the WENs into the agriculture survey so that it's routine? And what will that entail for you? And then do you intend to continue collecting this data on your own without donor support? And number 3, for what you've already collected up to now, what are the policy implications you foresee? I understand maybe the data is still very fresh, but what plans do you have to use this data for policy so that we can see the impact of collecting survey data so that it doesn't stay on the shelves?
Okay, thank you so much. One question that I have for the 3 of you is if you have any comments or recommendations in terms of translation of the tool, how it went, because we have the tool in English, but we know that when it comes to go to the field, the tool needs to be translated. So I wonder if you have any recommendations or any thoughts about sort of like particular words, like, influence, decision making. So which sort of like lessons you can give on that. And quickly, the second one is related also with the time, like where in the survey did you place these modules? In the middle, at the beginning, at the end? Thank you.
Thank you so much for the presentations. My name is Brenda Nakamba. I'm coming from the Zambia Statistics Agency. Actually, I really appreciate this particular workshop. I think it's we have learned something for us who have not yet implemented the WEN survey, and we hope we'll be able to implement it one day. But I just wanted to find out on the strategy that is used for data collection. I think it should be Liberia or Sierra Leone mentioned that they do one, which is the agriculture survey, the main interview. Then they do about 1 to 3 interviews at the same household. So that comes to a total of 4 interviews at that particular household. I wanted to understand the strategy that is used. Are they done like you interview the agriculture module, the main interview, then you go on and interview the other 3 eligible household members. I just wanted to understand because I look at it to be like respondent fatigue, altogether it comes to like 4 interviews at that particular household. Are we able to do it at the same time? Or there's a strategy that is normally used maybe after a day or after some few hours? Thank you so much.
Yeah, thank you for the nice presenters. My name is Isaac Mali from Malawi National Statistical Office. Yeah, so my question goes to Mr. Kamara, and also it will be more like a suggestion. One of the challenges that he mentioned is to do with time, which of course led to the failure, if I may call it, conceptualizing the questions, especially on the questions related to the influence of women. So my question is, do you think that the idea that we normally use in other surveys, for example, the use of show cards, okay, and also again the same, which I believe was one of the issue to do with maybe the food groups. Do you think buying ideas from other surveys, like in Malawi, we have the integrated household survey, other they call the budget survey, we use normally the photo aids. Do you think those solutions can be one of the solutions to, of course, improve the quality of the survey, of the service? Again, lastly, is the issue which I think has been already asked by one of our colleagues here, the issue of translating the questions, which is also crucial. So what I'm saying is, maybe it's also a good idea that we, as much as we're implementing these surveys, we should be also buying ideas from the already implemented surveys within our National Statistical Office. Thank you.
Right. Before I permit our dear panelists to share, there was one global question around the people who designed the tool. Who would like to respond to that? Okay. Half a minute to respond.
Yeah, just very quickly. I think we didn't have such a big phenomenon on single-aided households in these particular surveys, so I cannot respond to that. But certainly, what we can conclude, what we can imagine in terms of women's empowerment is that if a household is aided by a woman, most likely this woman is actually coming with a lot of responsibilities. These are the woman that is simply disposed of. So that's a simple reflection, but no, in the police service, we didn't have this major demographic phenomenon that is coming out.
I would say that actually in some of our earlier work, we have worked in places where there's quite a big single adult household. And it's a very interesting question that you can actually unpack. So if your survey has sufficient sample observations for this, we would recommend actually analyzing them separate, because as was discussed, the dynamics there are probably very different from a household where you have a couple. So I would encourage more analysis, but it is something, as long as you have the roster and you know who's in the household, this is an analysis you can. So
the question would be now, were they included? If they happen to be randomly selected, were they included single parent or single parent households, or were they excluded, or it was not a consideration?
I think that's.
Yeah. Yes, please do.
For us in Sierra Leone, we also have similar demographics in terms of, but we classify them as female-headed households. So in implementing our surveys, of which WEN is not an exception, those households are also included. And for us, most of those households that are headed by female, they do most of the agriculture in Sierra Leone. So don't leave them out and bring them on board. If they happen to be selected, we also cover them. We also administer, as long as he or she, as long as she has been sampled or selected, the enumerators will interview those households.
Microphone, you might as well stay with it for 3 minutes to respond to the issues that were global that each and every one of you will respond to, including the issue of seasonal bias, time availability for food and non-available.
Okay, that's fine. In terms of availability and non-availability, for us in Sierra Leone, the month of July and August, we call those 2 months as the lean season. We also term them to be the hunger period. But even though there are other type of food, groups of food that may be scarce, but most of the crops or most of the food groups are available. And the reason why we are implementing agricultural service during that time, we also know those households that are food insecure, so that in terms of food availability, in terms of scarcity, we also consider those households. They are food, especially agricultural foods, during that lean season. But for us in Sierra Leone, what is mostly scarce during that season, they are grains, rice, which is the staple food. But for all other food like maize, you talk of green leaves, they are all available. So it's not an exception to the timing. And also somebody talked about the timing. For us in Sierra Leone, we talk of the time not for the survey. We talk of the rainy season and the dry season. During the rainy season, it's the weather. We cannot forecast what will happen in the next 2 or 3 days during the rainy season. So there were floods, heavy rains. So they make the roads or the EAs inaccessible to the enumerators. But in terms of timing for the training, it's only during the data collection. Because of the heavy downpour of rain, it makes most of the roads inaccessible. And it also makes the water table becomes higher. So there is somebody that asks why we should continue to integrate this model into our national statistics. For us in Sierra Leone, I will say, yes, we will continue as long as there are resources, because we've started and there are now structures in place. All the structures are there. All stakeholders know about it. So we'll continue to integrate that with effective coordination and planning. Somebody talked about the data. So that's why before my presentation, I appreciate FU, because it has taken a long. So for us, what we did with we've already, our data is already in our website, www.statistics.sl. It is there. So also we have the summary report. And we also receive support before we launch the WEN survey on how to write policy briefs for our policymakers. And as head of the agricultural statistics section in Statistics, data requests have been coming in. Our policymakers asking for this data. And even we are implementing a project called the Feed Loan Strategy. We want to make the country food self-sufficient.
Okay, thank you.
So we are using the data.
Yeah, thank you so much. From Liberia, there are 3 things: food availability bias during the time you collected, opportunities or prospects for translating the tool, intention to integrate the WEN into other statistical surveys, and plans to finance without donor support in 1 minute, all of them in 1 minute.
Thank you, thank you. So let me start with the last one. The WEN result is very good for the country. We intend to include it every year, but the key problem we have been facing and we still face is funding. We don't normally do crop survey every year because of funding. The recent crop survey done now is done because there was some funding under the HISWA World Bank project. So we intend to do that if funding is available. Someone asked about translation. In my country, we have a little high illiteracy rate, and people there, we have several local dialects, but in common, people speak what we call Liberian English. And the good thing about it now is that for most of the household you enter, people speak Liberian English. So we are not intending to translate it to dialect, only to contextualize it to Liberian English. That is why we are calling for time and inclusion of other stakeholders from different institutions that will help us in this way of local last name questionnaire, but not necessarily translating it into our 16 dialects, no. Because sometimes if you do the translation, it sometimes change the meaning of the questions. And then somebody wanted to know how we do the interview with multiple modules in one household. So it is important to note that the WEN questionnaire have its own enumerator, separate only for WEN. That person is with the team, only to capture the eligible persons on a WEN and then start the interview. But where we face the problem with time is that when the person eligible for WEN is the same person under the crop code that have a plot to be measured, that is when the time issue comes in. So the crop code module is within the ILP. So if you look at it critically, it's only 2 modules. So the ILP have enumerators in both crop code, and then we have a separate enumerator. That person interview only the eligible person for WEN only. And someone asked another question about that one is difficult. It's difficult. That's what brings in the collaboration. If you find out that our recommendation that for future implementation is to collaborate, this is what brings the collaboration. Because if you notice, the indicators in WEN are mostly important for most institutions, Ministry of Gender, Ministry of Health, the nutrition part. So when collaboration comes, probably fund can be available. So yes, we intend to do that. The next question was around what? Okay. So for this, normally the crop survey, as I said, the core module in the annual crop survey is for production. In my country, production is done in 2 seasons. You have to capture production, and you and myself know that the major methodology to capture production is crop cut. So we do the survey during crop cut. So integrating the WENs now will not have another time. We will have to go to the field the same time people are crop cutting. So maybe I think what we can do, because I know maybe this person who asked the question wants to know what will be the situation of food availability outside of the harvest season. So in the IIP, there are questions asking about food about farmers' behavior when it comes to food availability in the past season. There are some questions in the IIP. So maybe for the WEN, some question could be posted like that for availability of food for other season. Maybe some question like maybe included in WEN. Maybe to capture the situation of food availability in the non harvest season.
Thank you. Thank you very much. Madam Noor, you have 1 minute to respond to all those questions. Thank you. The issue about food availability bias in terms of influencing the responses, translation, integrating the WEN in other statistical surveys, plan to finance without donor support, and I think this one has been responded to. Multiple interviews in a single household.
One by one. Okay. I start with the one of time of training. In our first WEN survey, we integrated the survey in the ASS. We trained both enumerators of ASS and WEN together. In fact, we had selected enumerators which were going to do WEN, but again, these are the same enumerators which were doing ASS. So we should have given, by now we know, like next time we should be giving these people who are doing both questionnaire, SS and WEN more time of the training than including them, like putting them together with the people who just do the SS, for them to understand more the module when they go to ask questions. So if you should say, if we want to integrate this in future survey, as my colleagues say, yes, we will involve this in future surveys, ASS, because it's interesting modules, as long as the funds are available for this, whether government or donors. So do we collect data by our own in case we don't have donors or we don't have funds? Statistics office usually collect data upon demand. If the demand is high and we have the resources to collect this data, we will collect this data. We are going to disseminate this soon. So now the government will see the importance of keep having this information, and we will do that. In translation, in Tanzania, we used Kiswahili. The questionnaire was translated by the consultant, by the professional. So we went through this questionnaire in Kiswahili. So data were collected in Kiswahili. I think then they were translated in English. So which model started between ASS and WEN? During the interviews, they started with the main questionnaire, with the core questionnaire, which is ASS. After that, that's when the respondent for the WEN questionnaires appear, and it goes on. It's happening the same day. The enumerator, they were planned to interview like 4 households, but depending on the length of the questionnaire and the interview, if you do the WEN questionnaire, you can do 2 or 3 so that you don't get tired during the interview. The seasonality, and I think the way I understood the question, why do we have to collect this information during the rainy season? That's how I understood it. But agricultural statistics are collected during the agricultural year. That starts from the 1st October, and that's usually a rainy season. So like in Zanzibar, we know we go to collect data during the rainy season, and we really are prepared for that during during the field work. We know we are going to be in the rainy season. Sometimes there are these shocks, and what happened, that's which spoil the situation, because we know our infrastructure, sometimes they get spoiled and it gets different too. So this may be if we think, my suggestion, if we think like integrating this questionnaire during the rainy season, then it should be done alone, whether when it's not a module in an agricultural questionnaire, or maybe it should be included in other surveys which happened in other seasons, but not the agricultural season. Thank you.
Wow. May we put our hands together to say thank you to the our panelists. We really appreciate your sharing of the experiences, the rich experience that is really going to inform future interventions. And I want to thank you so much, the audience, for listening in and asking very pertinent questions that indicate you were really following. Thank you so much. It's now lunchtime. Generosity is killing me. So the lunchtime is 1.5 hours. Yes. Thank you so much. Yeah. And let's reconvene here.